Herded Health is sponsored video content brought to you by MedCity News.
Hello and welcome to Herded Health. I'm Marissa Plesha, reporter for MedCity News. I'm very excited to be here with Chris Sigaran, Chief Commercial Officer of Imagine360, a company offering health plan solutions. Thank you so much for joining.
It's great to be here.
Yeah, absolutely. And so you recently, or Imagine360 recently published an article in MedCity News talking about how healthcare can learn from another kind of company, Costco. Can you talk a bit more about what healthcare can really learn from Costco?
Absolutely. So we're in a company meeting and we're having a conversation and we're talking about how do we get employers and employees to engage differently with the healthcare system. And someone brought up Costco. I said, look, I'm willing to drive a little further, get a big shopping cart, deal with some lines and a little more work because of the value I get when I go to a Costco. And said, we're the exact same thing, but we're doing it for healthcare, which is a much bigger expense and much more important to the average American worker that's out there. And so we have built an organization and a health plan around a very similar model where we create significant value. We ask employers and employees to engage differently with healthcare, and in return for that, we can save between 15 and 30% in the first year, so real hard American dollars, both for the employee and for the employer.
Yeah, absolutely. So going off of that and keeping the analogy going, you know, the number of Costco memberships have increased alongside inflation the past few years. What industry trends are really driving adoption of Imagine360?
Yeah, it's a great question. So first, and we've been coming to this conference for a long time now, and every year it's, hey, costs are out of control and we need to do something. And that remains true today. I mean, we've watched grocery prices go up, and again, Costco adoption go up with that. Similar healthcare costs are unsustainable. And what we've seen from our clients is progressive brokers, HR people, CFOs starting to look for alternative health plan solutions where they can save money. And again, if you think about it, if someone is willing to shop differently for something that doesn't cost as much as healthcare, especially in the current healthcare environment, our belief is, and our experience with our clients is, they're willing to do a little more work, be more engaged with the healthcare system to save money. Because at the end of the day, if you think about like a median salary at a lot of employers now, $50,000, if they've got a $6,000 family deductible, in some cases $12,000 family deductible, and before taxes they're making 50 grand a year, what happens in January when they end up in the hospital, right? They're going to end up in collections on a, in a general like Blue Cross, United, Cigna, or Aetna plan. With our plan, we create the environment where through engaging differently with the healthcare system, they can actually afford their care. And so we think it's not just about saving employers money, but it's taking back control and giving that back to the employees as well.
Yeah, really well said. And we also know that Costco is known for great customer service.
Yes.
Can you talk a bit about how customer service plays into Imagine360?
Yeah, it's a wonderful question. So again, if you think about asking people to do a little more work, right? So it's not going to get a soda at Walgreens, which may be convenient, but it's going to cost you twice as much. If you're going to ask someone to engage differently with healthcare, just like Costco does, you have to provide a really great customer experience. And so we're not just about saving people money, we're about supporting them in their healthcare journey, which, by the way, very few people say, hey, I really want to engage with the hospital right now. Generally, it's something that happens to you. And when you're on that journey, if you've had a family member or personal experience, it's a scary and very lonely process. And our team really does take control of that process, engage with members, and serve as a guide through their healthcare journey.